All right, everyone. We have a great session today, so I'm going to go ahead and get us started. I am Amanda Lakin with the Nevada Housing Coalition, and welcome to our July Lunch and Learn. If this is your first time attending one of our Lunch and Learns, welcome. We're very excited to have you. I have two quick announcements before we get started today. The first is if you are a coalition member up in Northern Nevada, we are hosting our Northern Nevada Housing Policy Forum tomorrow at the Atlantis Casino in Reno. It will be from 9 a.m. to 3 p.m. So if you haven't signed up and you would like to join us, registration is going to be open through the rest of the day. It's $50. We have a breakfast and lunch for everyone. We're going to have some policy pitches from our coalition members who are going to be sharing some of their ideas to solve Nevada's housing crisis. And then in the afternoon, we're going to be doing a really fun interactive housing shuffle where we are going to have you move around the room and learn about some of the policy priorities that the coalition is considering for the 2027 legislative session. So if that sounds interesting to you, we would love to have you come and join us tomorrow. Again, registration will be open through the end of the day today, and we'll close at midnight. And then last but not least, our 2026 Nevada Housing Conference is coming up September 23rd and 24th in Reno. We have early bird registration rates that are going to be good through the end of the month. So if you would like to join us and save $50, please register by July 31st. And then if you are interested in sponsorships, we do have a variety of sponsor levels available. This is a really great way for you to get your name and organization out there. We have exhibitor tables available, logo recognition, speaking opportunities, lots of different choices. And your sponsorship goes directly towards supporting our conference and really making it a great event for our attendees. So that is all I have for you as far as announcements. And I am very excited to turn over this session to Ann Johnson, CEO and principal of Spark Flight Studios, who's going to be moderating this session today. Welcome, Ann.
Thank you, Amanda, and thank you to the Nevada Housing Coalition for bringing us all together today. Good afternoon. So as a community-focused architect, I'm really pleased to moderate today's essential conversation, Housing Stability in Action, Community Solutions for Diverse Needs. Housing is often described as the end goal, but for the people and organizations represented today, housing is more accurately the starting point. And Amanda, I don't know if we've got our slide deck. Awesome. That'll be up there. So housing is the starting point. It's the place from which safety, health, recovery, employment, education, and connection can really begin. And the scale of the need that we have right now is very significant. Um, the preliminary 2026 point in time results, and we've got those stats up here too. They identified 8,859 people experiencing homelessness in Clark County, which is a 12% increase from 2024. And then Washoe County counted another 1,787 people. So we've got more than 10,600 Nevadans across our two largest population centers on a single night. And that point in time count is really only a snapshot. It doesn't fully capture people that may be doubled up with family, living in unstable situations, or who might be one crisis away from losing their housing. So just significant and gives you a little bit of a context. But today, our focus is not only on the size of the challenge, it's on what is working and what must happen next, and how housing and supportive services really work together to create lasting stability. Our panelists serve very different populations. So next, they could be youth experiencing homelessness, older adults, people living with HIV or AIDS, people who are blind or visually impaired. And then some of Sparkflight's recent projects include supporting families achieving stable housing and also women who might be rebuilding their lives through recovery and transitional housing. These programs all may look very different, but several themes are connecting them. There is dignity, accessibility, human connection, and support that is tailored to the person rather than expecting people to fit the system. So, as an architect, I also see the built environment as part of that system. A building cannot replace services, trust, or relationships, but it can either remove barriers or reinforce them. and it can communicate safety and belonging, or it can lend uncertainty or exclusion. And so, and then we'll go with our next one here. So we're just highlighting a couple of examples here. The Family Navigation Center in Las Vegas is one example that's been open for just over a year now. And that was developed with Family Promise of Las Vegas and with Clark County support. This is a 12,000 plus square foot campus that combines family services, training, counseling, and program spaces, secure outdoor areas, and 10 bridge housing apartments so that families can remain together while they work towards permanent housing. And this facility was planned to expand service capacity to about 350 families or 1,400 parents and children each year. The design uses trauma-informed principles, clear wayfinding, natural light, calming spaces, privacy, and residential scale materials. And these choices might seem small compared with funding or policy, but they also matter. And a parent arriving in crisis should not have to decode a confusing building or repeatedly tell a painful story in a public space or wonder if their children are safe nearby. And then moving to Northern Nevada, we've been working with Washoe County's Human Services Agency on improvements to the River House and Serenity House at the Women's Crossroads program. And we actually just did a grand opening for this, so we don't have our pictures yet. But this combines transitional housing with recovery support, case management, employment assistance, and opportunities to rebuild um, women's lives. So this is a setting in which they can stabilize, recover, and prepare for independent living in a peer-based program. So all of these projects have reinforced something I expect we will hear throughout today's discussion, and that's housing stability is created by an ecosystem. It requires an affordable and accessible place to live, but it also requires services, transportation, healthcare, funding, partnerships, and people who continue showing up. So today we invite each panelist to share the work of their organization, the barriers their clients encounter, the successes they are seeing, and what they need from the broader community to keep that progress moving forward. And as you all listen, I encourage you to consider these questions. How do supportive services reinforce stability for the population being discussed? Are there any common barriers that prevent vulnerable populations from obtaining and maintaining stable housing? And then where could you, your organization, profession, or community become part of the solution? And we're going to begin with Darnell Duwyenie, who's the programs manager at Golden Rainbow of Nevada.
Hello, everybody. Good afternoon. I am Darnell Duwyenie. I'm the programs manager here at Golden Rainbow. I do have two shout outs to give. One is Nevada Housing Coalition, Maurice and Amanda for giving us and the other presenters the opportunity to highlight the work that we're doing. And for the participants that are in the room, you clicked on the link because housing is your calling. It's very challenging. It's no easy feat, and I just thank you for being here and thank you for being present. Next slide. So before we get into what our organization does for the community, I do want to give a landscape of why we do the work that we're doing and how important the work that we're doing is necessary. And so the next two slides are going to show you some national and local data that'll give you some more insight about housing insecurities for those living with HIV and AIDS. So if on your screen, you'll see the national data statistics for people living with HIV and AIDS. That is the acronym you see. So about 1.2 million Americans are living with HIV and AIDS. 370 of those have housing needs. Out of 100,000 of those living with HIV and AIDS are houseless, and only 46 of those are served by a very specific program. It's the only federal program assisting those with HIV and AIDS and housing intervention support services, and that is the HOPWA program. That stands for Housing Opportunities for Persons with AIDS. It is the only, again, federal program that assists only those living with HIV and AIDS with housing interventions and support services. Next slide. These numbers are really alarming because they really translate to where we're living now, which is Nevada in our own backyard. So when we're looking at the data for housing insecurity, especially those living with HIV and AIDS, we're looking at about 13,000 residents of our community living with HIV and AIDS, about 600 newly acquired diagnoses, and then 20% of those are living in unstable housing situations, which equates to about 2,600 people. So when we're looking at these numbers, they are alarming. It speaks to why the work, well, number one, why we're doing the work that we do, and two, to spread awareness that, our most vulnerable population needs some help. Next slide, please. So Golden Rainbow was founded by the entertainment community of Las Vegas. One of their community members acquired HIV during the rise of the AIDS epidemic, and unfortunately, due to fear and stigma, he was removed from his home and was forced to live in the garage. During that time, the AIDS epidemic, it was a death sentence. No one knew how long they were going to live, and more than likely, they were passing away. Unfortunately, this person did pass away in his garage. His family, community members, performers rallied together to have a call of action to not let this happen again, and they created an annual fundraiser called Golden Rainbow. Funds that were raised were to provide assistance, support, and housing needs for those living with HIV and AIDS and housing instability. They did not want another community member to die within their garage, but to die with purpose, to die with respect, and to die within their own home. Next slide, please. So this is our mission. Golden Rainbow is the agency of choice supporting those living with HIV and AIDS in Southern Nevada by providing emergency assistance, education, financial aid, and affordable housing in a safe and inclusive environment. Sorry. We really are managing that and providing more housing assistance to the community. We are about 39 years in operation. Next year will be 4 decades. Next slide. So the eligibility criteria for anyone for enrollment, these are 3 major factors for anyone to receive any of our services and support services. They must live within the city limits, so that includes City of Las Vegas, Clark, North Las Vegas, Henderson, and some surrounding areas. We're also in Nye County specifically for the residents of Pahrump. So we have just started to assist them this year. You must be considered low income, and that's defined by HUD. Low income meaning that you have to meet under a certain threshold of your income to qualify for the program. For right now, that's $57,150 for a one household. So anything under that to no income, you qualify for our programs. And of course, since we are funded by Housing Opportunities for Persons with AIDS, which is the acronym for HOPWA, you must have an HIV and AIDS diagnosis to qualify for the program. Next slide. So these are the funded programs, the HOPWA funded programs we have for the upcoming year, which we just started in July. Majority of them are all housing programs as we're a housing organization, but we do have some support services to round out someone's housing. I will go through them each one by one because the acronyms can get a little confusing. But I also want to give you just a little bit of insight of what these housing interventions really do for the community. So our main one that we mostly use is the short-term rent, mortgage, and utility assistance, STRUMU. This provides one-time payments to rent, mortgage, or utilities, the essential utilities, to keep the lights on, to make sure clients are stably housed, and to really help them out at their time of need. To the right of that, we have PHP, Permanent Housing Placement. So anyone who is coming from homelessness, we're able to pay for those moving costs. So typically, it's like the first month's rent and security deposit, but we also can pay for application fees because we know those are really expensive and those can get costly. Another program that we have is our Permanent Supportive Housing Program. This is our project-based rental assistance. We have 2 properties, 12 units, and we pretty much give we give our clients the opportunity to get a leg up on a path to self-sufficiency with long-term rental subsidies, very similar to Section 8. And then below that, we have our transitional housing. Those who are in that mid-range of getting out of homelessness, but getting into permanent housing, we're able to house them into a hotel motel very, very briefly while they enter into their next place of living. And then last but not least, to really round out all of this housing, we have some support services. That includes employment assistance. So anyone who is wanting to get gainfully employed, we will pay for those services. Anyone who wants to increase income to their household, we will pay for those services. The other support service we do have is legal documentation. Anybody has to legally identify themselves to, number one, get housing, number two, apply for anything. So this is a definite need for the community, and it's the most underutilized service that should be utilized most often. But we birth certificates, IDs, passports, name changes for trans identified folks. We can definitely get those, and those costs will be paid for by our organization. And then transportation. We provide monthly transportation to our tenants in our project-based rental assistance program because they have housing goals they need to achieve, and this transportation assistance does help them. All in all, when it comes to these services, housing instability creates poor health and poor mental health outcomes. Not only are we, creating an environment for clients to be stably housed, but there are a lot of major factors that are happening as well while they're being stably housed, and that is getting them on a healthy path to living. And so, anyone that is diagnosed with HIV and AIDS, they are put on treatment, and we call this treatment as prevention. They're put on a treatment plan and they're trying to reach two words, which is viral suppression. Viral suppression means that they are taking their medication as prescribed and the virus is so low that it cannot be detected. We call this U equals U. Undetectable equals untransmittable. So the client is, if they are virally suppressed, they cannot pass the HIV virus to another person, even through condomless sex. So number one and number two. Number one, it gives the participant or the person who's living with HIV and AIDS a sense to live a happier and healthier, longer life, but also it stops the spread of HIV here in Southern Nevada. And that's really, really great news because not only are we keeping our clients stably housed, but we are lowering the transmission rates when it comes to HIV and AIDS. And I was just in a meeting not too long ago, and we are at the high 80 percentile of residents being virally suppressed. So we are doing great work. Next slide. So how do you get in contact with us? Everything is kind of through our website, goldenrainbow.org. You can kind of see there's some tabs at the very top that kind of gives you more information about our services. You can hover over it. It has certain areas, forms for clients and for providers. And then at the very, very right part of that web page, there is a contact section. And that's what you see in the lower box, in that white box. That contact section is for anyone to get in contact with us. We've had concerned relatives, we've had case managers, input their patient's information so we can follow up with them. I follow up with these within 24 hours to 40 hours of notice. Clients, there is a specificity if you need to of why you're reaching us, the preferred methods of contact, and they can add anything additional if they want to within that specific contact section. Next slide. And this is our information. I'm certain that Amanda will provide all of this information after the webinar, but I want to thank you for your time. I want to thank you for being present, and we look forward to meeting you. Thank you.
All right. Thank you, Darnell. And my name is Julianna Glock, and I serve as the Supportive Services Director for Volunteers of America. And today I'm here to give you an overview of some of the things we do in the Northern Nevada area, as well as present on Highway 40, which is our newest project, and how it supports our broader mission of creating healthy communities throughout housing and supportive services. So at VOA, our mission and vision, they guide the work we do, and our values of love, flexibility, and passion are really reflected in how we approach our housing and our supportive services. Next slide, please. Our work spans across shelter services. We are the operator for the Nevada Cares campus as well as our place. We offer affordable housing at Sierra Manor as well as the Village on Sage Street. We have permanent supportive housing at our Restart program as well as Highway 40. And then we offer supportive services such as housing navigation, case management, and clinical services. We serve a wide range of populations, including men, women, families, seniors, people experiencing homelessness or housing instability, veterans, and those living with a disability. Our newest project is Highway 40, which is part of our permanent supportive housing portfolio. It represents a targeted investment in housing for individuals who need both affordability and stability. It's designed to support long-term success. This project is an example of how we rehabbed a motel into purpose-driven housing. Highway 40 is located at 1750 East 4th Street. It has a total of 28 units, 6 one-bedroom units, 21 studio units, and 1 manager's unit. The unit mix is designed to maximize housing opportunities while maintaining a manageable, supportive environment for all of the residents. In addition to the apartments, there is a dedicated community building. This community space has a full kitchen for larger group gatherings. There's a food pantry, bathrooms, laundry, and space for events such as groups or classes. The shared space is meant to foster connection, reduce isolation, and create opportunities to engage with community partners in a meaningful way. The units are all fully furnished. They all have their own kitchens. There is a pet area, so pets will be allowed. They're designed for single occupancy. However, in the one-bedroom units, we would consider like partners or 2 people. The eligibility is focused on people who are referred through coordinated entry. So they do have to be literally homeless, have a documented disability, and at or below 50% AMI. However, we will probably be serving more 30% and below AMI. This will ensure that the project serves people with significant housing needs who will all benefit from both affordability and the services. How the project came about. It's been quite a journey. So this shows the project when we initially bought it. The purchase was through multiple funding sources. So in March of 2022, we received $2 million from the city of Reno. Then in July of 2023, we received an additional $350,000 as well as a $100,000 donation. All of that funding went to purchase the property. Those early investments were critical in helping us acquire the site and move the project forward. So after the purchase, the construction began. In April of 2024, we hired an architect and started with the design. In January of 2025, we issued an RFP for the general contractor. In February of 2025, we hired Metcalf as the construction manager and general contractor. We utilized what they call a CMAR process for that. In May of 2025, the permitting and construction began. In April of this year, the construction was all completed. May and June, we worked on furnishing all the apartments, getting bedding, all the kitchen utensils, everything that you would need to live independently. This month, we have completed hiring all the staff, and they are currently working on training, and we're excited to start housing people next month. So the funding for the construction was made possible through multiple awards through the Home Meets Nevada initiative and the Nevada Attainable Housing Account, which all came through the state of Nevada, the Nevada Housing Division. The total construction cost almost $6.9 million. This funding really demonstrated both strong partnerships and persistence, which are required to bring a project like this to life. But housing is only part of the model. Services are equally important to help residents stabilize and succeed. So in June of 2025, we applied and were awarded $1.4 million from the Supportive Housing Development Funds, which will provide access to case management as well as peer support. And in March of 2026, we have applied for an additional $1.4 million through the Supportive Housing Development Account, which will add additional case management and peer support. The services are such a critical component to create stability and really maximize that independent living. So these are just some pictures that I added so that you could see the finished product. It was really important for us to create a space that really feels dignified, welcoming, and ready for the residents. So now we're getting ready to open. These are just some pictures showing the units now that they're furnished. Highway 40 is really more than a capital project. It is part of a broader strategy to pair housing and support, partnerships, and long-term community impact. And that is it. So thank you for your time and allowing me to present. And I would like to introduce Todd and Multi next from the Blind Center of Nevada.
Thank you, Juliana. Appreciate that. It's an exciting project. Thank you all for allowing me to be here. Thank you to the Nevada Housing Coalition for inviting me to present Visions Park. For more than 70 years, the Blind Center has been serving the visually impaired here in Southern Nevada. And you can show the next slide, Amanda. This is what the Blind Center looked like until 2018. So it was a building built, the building in the front there is 1955, built by the Lions Club organization. And then in 1986, the building behind it was added through CDBG funds to help provide some other programming for the Blind Center. The next slide. And then in 2018, we raised about $9 million to build the Visions of Greatness building. Some of you have been here to the Blind Center for different kinds of events. We rent the space out for corporate and social events as part of our funding and to serve our mission. And then we have a culinary academy to teach people who are blind how to cook. And so some of those people that go through the 12 stages or courses with our chef, which he will tell you are pretty grueling. So if you make it through that process, then you could perhaps get a job in the culinary and catering division of the Blind Center. So helping to support not only the events we have on site, but we also do outside catering as well. And then we also do electronic recycling out of the Blind Center as an enterprise that supports about 60 to 70% of our funding. So many of you have donated electronic items or know about that. And so we appreciate that support as well. But today we're going to talk about Visions Park. Next slide, please. And so we, looked at it around COVID time, we started asking ourselves, what are some of the most important problems that the people who are blind we serve are facing? And, because we're serving largely people who are living below the extreme poverty level, these folks are having a tough time with affordable housing. Some of them are couch surfing. Some of them are living 3 or 4 or 5 people to a 2-bedroom apartment just to survive, so to speak. And most of the people are living on a Social Security check. And so if you can imagine yourself, any one of us can go blind at any time. And some of these people had, jobs that, in a casino or doing other things. And so they've blindness sort of completely changed their life, and navigating to find affordable housing is pretty challenging. So we didn't understand the scope of what the problem looked like, but for the people that are having this trouble, it's not just about blindness, but it's also about isolation. So there's a mental health component to it. There's a, what do I do? There's a safety component to it. Like, nobody wants to go travel the streets as a blind person going to figure out where they're going to live. So there's a component that, we needed to sort of figure out how to help them. And then I, was fortunate enough, most of the people on this call know who Frank Stafford is at the Housing Authority. And so I called him one afternoon because this map that you see on the screen, the north side, the top of the screen is Gregson Avenue. And that area to the north of the Blind Center there is called Archie Grant. And so it's an affordable housing project that the Housing Authority owns, or owned at the time exclusively. And I called Frank to say, hey, Frank, we've got this problem. I found out we have 35 people that we work with here at the Blind Center that are on a waiting list of about 2,300 people. And what I understand, there's no preference for blindness on that list. And so what could we do to help move people up that list? And he said, well, it was so great. And by the way, this project wouldn't exist without Frank's tutelage and his support of Visions Park. So anyway, he was so direct in what he was saying. He said, listen, if you want to know the truth, it's going to take you about 36 business years for you to move your 35 people through that list. And so you're probably going to have to build your own project. And so you say, well, what does the Blind Center know about affordable housing and building housing? Not much. And so anyway, as we talked a little bit, Frank and I, he kept in touch and he started talking to us about what would it take to do it. And so we then hired another organization most of you all know, and that is Praxis Consulting. Praxis is sort of the expert in affordable housing as it relates to finance and development. And they really helped us to navigate the whole scope of it. Feasibility, is this even realistic for us, right? So as we work through, sort of an ideation process of whether or not this even makes sense, in that time frame, we went ahead and in the screen, you see this phase 1 part, which is right next to the yellow section where the Blind Center is located. We bought this church that was willing to sell to us. So we acquired the land, and then through lots of meetings and collaboration and, trying to get this thing off the ground, really a lot of perseverance and other things that, came together. We figured that if we could convince the funders to get behind this project, then, we could make Visions Park a reality. And so, next slide. So, I see Carol from Senator Cortez Masto's office is on this call. And, a lot of this funding that you see in the screen is related to the ARPA money that was available at COVID time. And most of us are recipients of a piece of that. Most of this project is a direct result of that funding. And so the state of Nevada gave us a little over $16 million for the project, Clark County $8 million through CHF, and then City of Las Vegas $4 million of ARPA money. North Las Vegas gave us $1.5 million in ARPA money, which was North Las Vegas CARES money, and then Henderson gave us $1.5 million. That amount of money helped us with the tax component of things. And then AHP funding, we applied and received 1.25 million there. And then the other thing that we received was 51 project-based vouchers. I know priceless because, as you know, Darnell and others know, when you get project-based funding, you know, it's complicated to do really well at affordable housing without subsidy. And so that's what that resulted in. So we were lucky enough to get that funding. And then there was Bev Rogers and some other Ingolstadt Foundation and others that helped participate. Next slide. And then this is a picture of what Vision Spark looks like today. We opened the waiting list June 4th. We started moving in residents last week. We're still accepting applications, and we look forward to anybody that you know that might benefit from the supportive services we're offering to apply. Supportive services really matter, and that's why Vision Spark really exists, I think, at all. It's about community. It's about you know, providing assistive technology and daily living skills and other elements of supportive services that make a difference in people's lives. And so, you know, there's a whole lot of other elements like food security and things like that that the Blind Center will offer next door to Vision Spark, but we'll have activities on site as well, including we'll have a full-time activities and wellness coordinator that will manage the activities and creating a community culture. And then we've hired ASI Accessible Space as our property management company. And so they know affordable housing for disabilities. They're a great company. We're super proud to have them. And then looking for the future, next slide. This is our 2030 plan. What we're looking to do, Blind Center's in the sort of the northeast, the top right corner there. That's our campus. We have Vision Spark on the bottom left. In the future, we hope to open Vision Spark 2. And then in the top left is Clark County buildings that are now being used for storage. We're hoping to do a workforce development project there, so we can use those to expand our workforce development program. So we want to create this culture of community that helps people really improve their lives, add meaningful jobs to it, and so forth. And then one of the other things we're working on right now, which I think is kind of a cool thing, is a AI innovation lab with Meta. And so we're hoping to open, you know, many of you have seen these Ray-Ban glasses that allow people to see using the cameras, and they have an app called Be My Eyes, and they help navigate blind people, you know, how to find their way around. So anyway, in closing, we're really super excited about opening Vision Spark. We're grateful for the collaboration with all the people that participated. So many of the members of the Nevada Housing Coalition have been part of this process. You know, Ovation, all the big people in affordable housing have played a role in helping us get this off the ground. So I want to thank all of you for your help in helping us get Vision Spark off the ground. You can see more at visionspark.org and then blindcenter.org for contact information. And with that, I will turn it over to Katha Lee.
Thank you so much, Todd. And thank you for everyone for telling us about the amazing services that are happening in our area. I'm going to share my slides real quick. Can everyone see? Okay, good. So my name is Kessa Lee. I am the Community Engagement Director with Eddy House, and I'm honored to be here with you today. We are a resource center, workforce program, and shelter for 18 to 24-year-olds, as well as outreach to 14 to 17-year-olds through high schools. So our vision at Eddy House is to end youth homelessness in Northern Nevada, which is a big vision. But I always like to bring these pictures that, with permission, of course, to really ground the idea that youth homelessness is just young people experiencing homelessness, are young people, and that's all they are. They're resilient, they make mistakes like we all do, they're figuring it out, and we're just here to support them along that journey. So a lot of times we get the question of why 18 to 24, why that cutoff? A lot of studies show that if someone is housed by the age of 25, they are far less likely to return to chronic homelessness. This 18 to 24-year-old range is a really unique moment developmentally, both socially, physically, mentally for these young people just trying to figure it out. And they also face unique barriers to housing. The first one would be family cycles. A lack of safety and support in the home is the number one reason that we see young people becoming homeless. Just a couple facts about our clients. A third of them have aged out of the foster care system. Almost half became homeless before the age of 18, whether that was with their family or unaccompanied. And 62% said that they felt safer on the streets or in a shelter than they did in their own home. So a lot of times young people have that safety net to just fall back on of, oh, I'm just going to ask my mom for that, or, oh, I can just go home for the weekend. But we're finding that the folks who we serve don't have that fallback, don't have that safety net. Another barrier that we see is lack of accurate data. A lot of times this is called the invisible population because they don't experience homelessness in the same way as other folks. So they're not the ones that you'll see on the streets or underneath stop signs. In fact, in the latest PIT count, they found in our area in Washoe County, children under 18, there was only 4 homeless children according to the PIT count on the streets, and young adults there was only 12. But if we look at other data from our area, Washoe County School District identified 906 kids as experiencing homelessness. And in 2025 at Eddie House alone, we served 586 young people. So the question has to be asked, where are these young people? If they're not on the streets, but they're experiencing homelessness, what does that look like? And some of our clients have shared their stories. A lot of them agreed that they would never disclose that they needed help or that their family was homeless because they were scared of ramifications at home if they spoke up. We also had one young person who was in all honors classes, working 30 hours a week, getting straight A's, and she put all of her money into Airbnbs or slept in her car when money ran out. And then another young person said that instead of asking for resources, he would just sleep at his school campus. At Sparks High School, there's a train car because they're the railroaders, and he just slept on the football field at his school and hid there instead of asking for resources. So there's clearly an issue here. And some of the other barriers that we're seeing of why they're not able to get housed is that age is not a protected class for young folks. So that you can go to an apartment complex and say, I would like to rent an apartment. And they'll say, you look like a frat boy and I don't want to rent to you. And then that is a perfectly acceptable answer because it's not a protected class for young people. And then there is a lack of dedicated resources specifically for young people. So for example, permanent housing numbers in Nevada, beds that are set aside specifically for young people, there's 126 in all of Nevada. There's just 126 beds set aside for young people. And as of 2024, 10 of those beds are in Washoe County, and there are 0 in the rural counties. So it's a huge issue. And something that we are definitely pushing for is more housing specifically dedicated for these young people to help them, like I said, get on their feet before 25 so that they can remain sustainably independent. So what are we doing about it? How do we help them overcome these barriers? Our mission is to create a safe environment for homeless and at-risk youth to develop the life and job skills that are necessary for sustainable independence. We never want to just put someone in a house for them to come right back to us. We really give those wraparound supports so that they understand how to stay on their own before we send them out. One of the ways we do that is through our services. We offer shelter, of course, safe, clean place to stay. We offer food, hygiene supplies, showers, laundry, as well as clothes. We always make sure that those basic needs are met first because we know that people can't move forward until they know that their basic needs are met. And then after that, we are able to work with them on getting education, getting them jobs, getting them certificates, whatever it looks like to help them move forward. And then we also help them get mental and physical health care. We have a bunch of partners that come here on site, which is amazing to meet with our clients. And we also employ 2 licensed therapists. And then we also have one of my favorite things is our programming, our life and job skills groups. So these groups are to help our clients really get that understanding that maybe they didn't gather as they were growing up. And we have a lot of amazing partners that come in and do these things. Everything that we do is in 5 main categories. We did a study with UNR on what a young person needs to be sustainably independent. And it boils down to these 5 categories of career and finance, housing and transportation, community, self-care, and essential documents. And so everything that we do 2 to 3 groups a day to try to help people understand and gain these life and job skills that are so important. But we also know that we're working with youth, and we want to make sure that we're still infusing fun into the things that we do, to help people understand what good, clean fun looks like. And so some of our groups, like instead of saying what to wear to an interview, don't wear this, do wear this, we do a staff fashion show. And so the staff walk through and the clients get to judge us, and they tell me I'm too tall every time. And but it's just really fun the way that we can infuse learning with fun every day. The way that these services work into our programs is that we start with outreach. I mentioned our high school outreach program. It goes into high schools and provides resources and referrals so that hopefully people will never need to come to the shelter in the first place. And then once someone turns 18, we have drop-in resources. So if someone comes to us and says, I have a place to live, but I have to choose between paying rent and eating food, then we say, let us help you with groceries, and let's hook you up with our workforce person and see if we can get you a job that'll sustain your rent better. Or maybe we can get you with a financial planner who can help you figure out where these bills are coming from. And then if we can't divert them, we do have emergency shelter. 24/7, a young person can come to our door and trust that they'll have a safe, clean place to sleep that night. Once folks have been accessing our drop-in resources for a while, they'll start meeting with case managers, and our case managers help them set actionable, obtainable goals so that they can watch themselves take steps forward and really build that hope and that resilience. And then they can apply to be in community living, which is kind of like transition to transitional living. It's a 6-month program. They have a couple extra freedoms. They get their own bed space. They get to bring in their own food. And then once they've been in that program for about 6 months, they can apply to be in transitional living. And I'll show you a little bit more about that on the next slide. And then once someone has moved out, whether they went through all of our programs or they just came in once and then moved out, we follow up with them. We have an aftercare coordinator who follows up 3 months, 6 months, 9 months, and a year to make sure that they have everything that they need and they're able to stay sustainably independent and really take away those barriers of coming back to ask for help. Our transitional living building is a 36 studio apartment, just opened last year. It's absolutely beautiful, and they have independence, and they pay a program fee, which means that if things don't work out and they end up back in the shelter, it doesn't count as an eviction on their record because it's a program, but they do have that independence with all the wraparound services right there on hand. Some of the impact that we've seen in the last couple years, or in the last year, is that we served 586 young people just last year, and the need is continuing to grow. We saw over 200 in just the month of January. And then we also are seeing that when people get housed, they are housed for longer and they return less often. And if someone has engaged in aftercare all the way through that year where they answer those check-in calls and talk to us, 95% of those clients do not return to the shelter. So we're seeing that these supportive services are really working. And we couldn't do anything that we do without our amazing partners. We have partners who help us with our life skills groups like Safe Embrace and US Bank, as well as Silver State Fair Housing and Nevada Legal Services. We have workforce partners who help us hire our clients like ESI Security, GSR, McDonald's. And then with the basic needs, Atlantis provides our dinners from their lunch buffet, which is really cool. And Good Shepherd's Clothing Closet provides all of our clothing for our closet. And then we have construction partners like Pinecrest helped us build that beautiful transitional living building. And of course, we have financial partners who give financially or in kind or do third-party events or anything like that. There's always room for more. We have hundreds of partners, and we couldn't do anything that we do without them. We recognize that we're not the experts in everything, so we just try to bring in the people who are and create that hub of safety for our clients. This is just an impact statement from one of our clients who said, I just love that a lot of us are given the opportunity to turn our lives around, to have a chance to feel like we matter. I was really getting help that was actually going to help me succeed. And that's what we want to do. We always want to make sure that we help our clients see that they have what they need. We're just here to give them a little hand up. So this is my contact information. My name is Kessa. I know I talk really fast, so if you missed anything, don't feel bad. Please feel free to reach out. My email is kessa@eddyhouse.org. I'd love to have you in for a tour. We can talk about what that looks like, and you can find more information on our website, eddyhouse.org. Thank you.
Thank you, Kessa. Beautiful stories. And I'm struck by how innovative and invested all of these organizations are. So thank you to each of our panelists. And we're going to take it back and talk about a few different targeted questions. And then if we can, we'll pick up some Q&A from the attendees. So we've heard different approaches and different populations, but also this consistent message that housing becomes sustainable when it's paired with the supports that people actually need. And so I'd like to ask everyone, and it's hard to choose, but what is maybe one supportive service or an essential combination of services that most determines whether the people you serve can remain stably housed? And let's go in the order of the speakers. So we'll start with Darnell and then go through Julianna, Todd, and Kessa.
Excellent, thank you. I think I mentioned this within my presentation, but legally trying to identify yourself. So identification is really important. Number one, to apply for an apartment, to number one, legal identify yourself, or even apply for a program. So I think that is one of those things that is highly needed before anything else. Juliana, what's your response?
I think the one service is probably case management. I think it's really important to have that service once you've been housed. I think it really helps provide motivation, planning, guidance, in order to remain stably housed.
Yeah, in my case, I think with Bishop's Park, we are creating a mental health navigator. And so mental health is a pretty big, that's a broad thing, but we're working with UNLV in the practice to define, how to identify where people are at in terms of isolation or depression or other things. And then we want to be able to provide them the tools they need to become acclimated in the community. So mental health is our biggest one.
I think for us, one of the things that I hear a lot from clients when I collect feedback is the importance of community and a mentor. So if they didn't have that stable house, having someone in their life to help them with those things like, hey, maybe you should load the dishwasher this way, just the little things, a mentor in their life has been huge and one of the biggest things that will help them to move forward.
Fantastic. So documentation, legal ID, case management, mental health navigation, and then having community and mentorship. So even in these answers, we can see it takes this ecosystem for success. We're running out of time, I believe. So let's combine a couple of our last questions, and then we'll jump back in with Amanda. But if we look ahead, so if we think about a barrier that's maybe outside of your organization's direct control, so Nevada, state of Nevada, local government, or the federal government could address to really materially improve housing stability. And then also maybe how can our audience offer supports in those areas? What would that be? And we'll start again with Darnell.
Thank you. We just need more inventory, more providers, especially those affected by HIV and AIDS. We only have eight HOPA funded agencies for all of Southern Nevada, and only 5 of those provide housing assistance. So we need the support, we need the partnerships. And to be honest, we just had a press release earlier today that the center has acquired us and AFAN to do bigger and better housing stuff. So partnerships really matter. And we just need more people at the table. Juliana, what's your response?
Mine isn't much different than yours. I think we definitely need more housing stock. developing more housing that is affordable. But also to your point, I think partnerships are huge because, nobody can do this alone. The needs are always so different from person to person, and so I think the partnerships are very important.
I tend to agree. I think the partnerships and collaboration is what made this project work. I think that one of the barriers that can help us all is just figuring out the speed of building inventory. I think there's a process of funding and fundraising and permitting and the whole thing. So it's a 5-year project in many cases. And if we can scale that back a little bit and make it a 2 or 3-year project, I think that would be helpful.
Yeah, I echo what everyone said. Partners, partners, partners. We couldn't do what we do without the whole community coming together to build a safety net. And really just more of those dedicated resources for youth, especially in the rurals. That's something that we would love to see, is more resources for young people who are experiencing homelessness in the rurals, or really all people. We just know what we've seen, and we've seen hundreds in the last 2 years, almost 200 young people from rural Nevada coming to Reno to receive resources. And so if we could spread that out and make sure that all of Nevada can get what they need.
Mhm.
Very insightful, each of you. So partnerships, speeding up development, and more housing stock. So Amanda, with that, I know we're at the close of this. Do you have some closing messages to
Yeah,
share?
I actually thank you all. I just did want to get to one question that was submitted in the Q&A, so I'll just kind of throw this out to whoever wants to answer. Do any of you have feedback from how business leaders, policymakers, and the public see the benefit of investing in affordable supportive housing? And then, also, are there any successful messaging or stories that you've seen that really help to build support for more investment?
Just one feedback item that I have is we had a roundtable with Congressman Horsford at Visions Park last week, and I think the commitment at the national level, the road to housing, road to 21st century housing bill that was passed, creates an environment for more affordable housing and keeps the voice of affordable housing on the docket for all of our leaders. And so I think that's the thing we need to do is continue to talk to our national representatives so that this voice of affordable housing and the need for more of it stays on the docket.
Wonderful. Anyone else want to comment on that question?
I think for us, I see a lot of times around here we talk about Million Dollar Murray. I don't know if you've heard of him. It's the example of an elderly homeless man who has cost the economy $1 million through the different emergency room visits and all of these different things that are going on. And then we always like to contrast that with the fact that it takes about $7,000 to $8,000 to house and give someone supportive services for 6 months to set them up for that success. So if the goal is to save the economy money, then why don't we start early? That's been the most successful argument for us.
Wonderful. All right. Well, thank you, everyone. I just want to give a huge shout out to our moderator and our panelists. You all put some great thought into this session today, and I hope everyone that is attending enjoyed it. We will be sending out a copy of slides and a link to the full recording by the end of the week, and I look forward to seeing all of you next month in our August Lunch and Learn. So thank you, everyone, and have a great afternoon.
Thanks, everybody.
Thank you.
Thank you
Thank
all.
you.